Hello, I'm Dr. Tom Lawrence. I'm the Chief of Plastic Surgery here at the University of Iowa Hospitals and Clinics. And what I'm going to talk to you about today is open incisional hernia repair. An incisional hernia is a hernia at the site of a prior surgical incision, often in the midline of the abdomen as shown here. Such hernias generally develop related to post-surgical wound healing problems resulting from infections or extra stress on the area during the healing period. Hernias, like people, come in all kinds of shapes and sizes. Smaller ones can often be managed with relatively simple laparoscopic procedures that don't involve large incisions. The ones that I deal with generally, however, are the more complicated ones. They're often recurrent and sometimes involve either a wound related to prior surgery or a significant amount of extra skin and fat. The first part of the procedure, as I usually perform it, consists of the surgical removal of skin and fat as well as any wound that is present. This often involves both a transverse incision across the lower abdomen and a vertical one in the middle of the abdomen. By removing the excess skin and fat, I can much more clearly appreciate the borders of the hernia defect. I can also very clearly tell which tissues are normal and healthy and likely to heal with a solid repair, and which represent scar that might not heal as well. I can also appreciate if there is more than one hernia that requires repair. After assessing the nature of the hernia defect, I proceed with the repair. Somewhat different techniques are used depending on the nature of the defect. Almost all involve supplementation of patient's native tissue with some type of mesh material. Some meshes are made out of synthetic material like Gore-Tex or polypropylene, which is a material somewhat like fishing line. I more commonly use an acellular dermal matrix. An acellular dermal matrix is skin from a person or animal that is treated in such a way as to remove all cellular and living elements related to the person or animal and leaving only the tougher components of the skin. The type that I use most commonly comes from pigs. The advantage of the acellular dermal matrix, in my opinion, is that blood vessels and cells from the patient move into it over time and it becomes part of the body. During the hernia repair, mesh is either placed underneath the abdominal wall, in other words, underneath all of these structures here, or within the sheaths of muscle on either side of the abdomen. Here in the central part of the abdomen are the rectus muscles, and this shows it from the side with a muscle in the fascial sheath. So either the mesh goes underneath this layer, or we divide this layer between the muscles and we put the mesh within the rectus sheaths. Sometimes an additional procedure called a component separation is performed to help get the normal tissue together. A component separation involves release of the top layer of the abdominal wall on either side of the abdomen, generally done in approximately this layer. This release allows the tissue to move up to an extra 4 to 5 inches towards the midline from either side of the abdomen and often permits the desired multi-layered closure involving both mesh and natural tissue. There are rare occasions when the normal tissues cannot be brought back together due to the amount of scarring. In these circumstances, the repair may only involve a layer of mesh bridging the gap between the two sides of the abdominal wall. Such a bridge repair is less desirable because it is much more likely to lead to a recurrence. One needs to be aware that open incisional hernia repair, as I have described it, is a significant surgical procedure and that there are always risks related to surgery. I can never guarantee that the hernia will not recur. However, with the technique I've described, the recurrence rate is low and people generally do very well. Please call me at the University of Iowa Hospitals and Clinics and I would be happy to answer your questions about incisional hernia repair. There is nothing routine about hernia surgery, and that is why we have a dedicated care team of surgeons from multiple specialties to ensure the best treatment and care are provided to our patients.